I could have gone somewhere else. I could have gone to a less expensive place. But, you know, it's actually harder for me to trust somebody and to go to somebody based on price. Like, I'm not going to someone for a value facial. It's my face, it's my brand, it's me as a person. So it's really important for somebody to make you look like, you know, I don't want to over-inject you. A lot of patients, you know, they come in and they're like, I want 2 ml of a filler, but it doesn't look good, and that's your brand. And with Dr. Sinha, you know, he's very keen on saying no sometimes. You might lose a patient. You know, I've asked him several times, I was like, well, can we do this and can we do that? He's like, you don't really need it, you know, and that to me means that a physician cares more about, you know, having you as a patient, as a long-term patient. So immediately after my injections, I could see the results. You know, areas of volume loss were kind of lifted. My lips looked plump and great, and, you know, I was in pretty much no pain, especially once, you know, once you do it more than once, the anticipation of the injection is a lot worse than the actual injection because of the numbing. So immediately after, you know, you do have a little bit of puffiness, a little bit of redness, but assuming that you take proper care and assuming that you follow directions properly, you know, you're not supposed to drink alcohol, you're not supposed to lay down for 4 hours, no gym activity for 24 to 48 hours. So as long as you kind of stick to the guidelines by the physician, I mean, they're there for a reason. So I, you know, became an expert at recovery from injectables. If the physician is really good, no one can tell that you've had work done. You know, the goal for me is to be natural. So with lips, it's actually really a sensitive area, and it's a sensitive area to fill because it's full of blood vessels, and, you know, the risks are higher, especially since you're very sensitive. And with a double board certified plastic surgeon, it's kind of their job to make sure that nothing goes wrong. And so, you know, being in good hands, being in Dr. Sinha's care, it was kind of easier, and it put my mind at ease that, you know, the lips have a certain symmetry and a proportion, but we don't also consider the fact that each person is different. So looking at a patient, looking at me as a whole face rather than, okay, I'm focusing on the lips and I'm going to do exactly what you want. You know, if it's based on what I want, I would want a lot. And so it's knowing that, you know, the surgeon is going to say, no, this is enough, this is not going to work for you, and if anybody else tells you otherwise, then they just want your money.